Welcome to the Heart of New York show. We have guests on the show today from Independence Care System, and I'm going to have them introduce themselves to you in just a moment. But first, I want to tell you that this show will help people who have loved ones who are at home or being discharged from the hospital, and we need to know how to care for them and what to expect and to have certain helpful hints. And so we're going to learn more about that, and it's going to be very informative. So Danny, would you please introduce yourself to the viewers?
Sure. My name is Danny Perry. I'm the Director of Community Engagement for Independence Care System, also known as ICS.
Thank you and welcome.
My name is Stephanie Reynolds. I'm the Director of the Transitions of Care team at Independence Care System.
Thank you and welcome so much, Stephanie. Thanks for coming on the show.
Thanks for having us, Angela.
It's great to have you back, Danny. We've already filmed a couple of shows with Independence Care System. Independence Care System is an MLTC, and for those of you at home who don't know what an MLTC is, it's called a Managed Long-Term Care Organization. When people get onto Medicaid, they need to find a care organization because Medicaid deals with the financial side, but an MLTC takes care of residents. And this is what I'm going to have Danny talk about a little before we get into some of the tools and other things we're giving you today. So Danny, tell the viewers about what Independence Care System does, what your mission and what your vision is.
Sure. So Independence Care System, or ICS, is a nonprofit managed long-term care plan dedicated to supporting older adults and people with physical disabilities, providing the needed home care, health care, and social services so that they can remain as independent as possible. We're similar to other MLTC plans in the sense that we provide an array of services on top of home care, transportation to medical appointments, dental, vision, hearing, physical therapy, and so forth. But what makes ICS unique is that we provide also a number of specialized programs and services. So for example, we have a dementia program, which we had talked about previously in another show, with certified dementia practitioners. We also have a program specific for people with spinal cord injuries, multiple sclerosis. We also have a comprehensive wheelchair program with community-based wheelchair clinics. We do an abundance of social programming to get our members out of the home and make sure they're as active as possible. We have a program called Consumer-Directed Personal Assistance Service.
What is that? Tell the viewers about that.
Sure. So Consumer-Directed Personal Assistance allows our members, if they so desire, to actually hire, train, and supervise their own personal care aides. And it could be a family member, it could be a friend, someone from your faith-based institution, pretty much anyone except for a spouse or someone who's legally responsible for the care. And so there's
and they get paid for that, right?
They get paid for it. And
Isn't that terrific?
Yeah, there's various advantages of the program. So we also have a care transition program as well, which we'll talk about further today.
Thank you. Stephanie, in as much as the show is about transitions of care, can you speak to the audience and tell them what this exactly means and how it impacts them for their elderly family?
Of course. Transitions of care is when a member is in the hospital, we coordinate with the hospital social workers and care managers to make sure that the person who's being discharged gets all the services and supports that they need in the community so that they don't end up back in the hospital.
Can you give us some tips or some red flags to look for so that people do not have readmissions into hospitals?
Absolutely. So asking your doctor about what signs to look for to that would tell them that your medical problem is getting worse. What should you do if you notice those signs? Also, what doctor should I follow up with after the hospitalization? It's especially important to see either your primary care doctor or a specialist within 7 days of being discharged home to make sure that the doctor understands why you're in the hospital, make sure that your doctor doesn't want to adjust your medications again, make sure that your doctor knows what tests you went through, and if you had any new diagnoses added to your diagnosis list.
Your PCP should know all of this.
Absolutely, absolutely. Because a lot of times the hospital will change your medication, and you want to make sure that your doctor knows that your medication has been changed, and maybe they don't want to have you change your medication after all.
Right, because a lot happens the first 2 weeks that you're home, I suppose, after, and plus
Yes.
your body is going through an adjustment.
So we have a tip sheet on hospitalizations and how to avoid going into the hospital. And then on the flip side, what if you do get hospitalized? What kind of questions to ask while you're in the hospital? What kind of questions to ask when you're ready to go home? And we also have these stoplight cards for a variety of conditions, for example, congestive heart failure, CHF. We have ones about respiratory symptoms, we have ones about urinary tract infections, we have ones about wounds, we have ones about falls. So we have all sorts of very good patient information.
Terrific, what a great resource. And UTIs are very common in seniors, mostly because they're not hydrated enough, I understand.
It's a variety of different issues. It could be related to hydration, it could be related to hygiene as well.
Sure.
So this is the tip sheet that we were speaking about that has information about how to avoid going into the hospital by going to an urgent care center or to your primary care doctor. And it also has information about what happens if you do end up in the hospital, what kind of questions to ask when you're in the hospital, what kind of questions to ask when you're ready to go home.
That's fantastic, and we are showing it now to the viewers on the screen, so that's terrific.
So the good thing is that all these tip sheets can be downloaded off our website. If you go to www.icsny.org, we have tip sheets on wound care and prevention, our wheelchair repair program, fall prevention, a host of other tip sheets as well.
So what are some of the important things that the viewers need to know about reducing hospital and emergency room admissions?
So there are definitely things that you can do to prevent going into the emergency room. If you have chronic medical conditions, most of those conditions have certain signs and symptoms that can occur that would indicate that your medical problem is getting worse. And so if you recognize those signs and symptoms early on, and rather than going to the emergency room, you can go to an urgent care center, or you can go to your primary care doctor and have the problem taken care of there.
What do you mean exactly? What kind of symptoms could you be exhibiting that might indicate this?
So what we actually have are, we have called stoplight cards that we use for our members, where we educate them about chronic medical conditions and what kind of symptoms to look for on a daily basis, so that you can say, you know, I'm not feeling tired, I'm feeling good, my energy level is normal, you know, I'm not coughing, this is my normal day. Or
And that
then
would
the
be
next,
green.
that would be green.
Okay.
And then the next day, you know, I'm feeling more tired, I need a little bit more help doing the things that I normally do, my cough is a little worse, I think I need to go to my doctor, or I need to go to an urgent care center. That's the yellow zone.
Now, let's talk about that more in depth. So, hopefully, the senior who's home alone without an aide would be able to determine this about their own care?
Absolutely. Absolutely. So this is something that they can put on the refrigerator or next to their bed, and every morning they can just kind of scan themselves, basically, and say, you know, how am I feeling? And then make a determination as to whether they're in the green zone or whether they're in the yellow zone. And hopefully it doesn't get to the point where in the red zone, because in the red zone they do need to go to the emergency room.
And what are the signs for the red zone?
Severe difficulty breathing, for example, or just not being short of breath, just sitting normally, having severe trouble sleeping, needing to sleep sitting up.
Oh.
Yes.
What would cause somebody to have to sleep sitting up, for instance? Nausea?
If they have congestive heart failure, CHF,
Oh.
that means that there's fluid that's built up in their lungs or in their extremities, and that helps, that prevents them from being able to breathe normally.
So it's generally to do with the respiratory
Yes.
issues when it comes to an emergency situation.
Yeah.
Now, do your members typically have aides helping them during the day, or are most of your
Yes.
members independent?
Most of
Totally.
them have aides during the day.
So I imagine that the aides would also notice some of these situations to determine if there's
Absolutely,
red
and they
light or
can
not.
help the member too. For example, if you have congestive heart failure, it's very important to weigh yourself on a daily basis. And the aide can then take down those numbers and maybe write them in a calendar so that you keep track of your weight on a daily basis, and you can say, okay, I'm not gaining weight, I'm good.
Well, that's so interesting, because I always picture seniors being frail and not eating that much and not having a weight issue. Am I misinformed?
Well, it's not that you're looking for nutritional information that way. It's you're looking at the fluid buildup in the body. And if you're gaining more weight, it means that your fluid is not getting, your body is not getting rid of the fluid, and it's sitting in your lungs or sitting in your legs, and it's, preventing you
cause a
from...
problem.
Yes.
So is heart failure a major concern for the elderly?
It is, in a lot of instances, and it's, our members have multiple illnesses going on. It's not just that they have one disability, they have multiple chronic illnesses.
Such as?
They have chronic obstructive pulmonary disease, COPD, for example. They have congestive heart failure, CHF. They have arthritis, they have obesity, they have high blood pressure,
Wow.
they have diabetes, all of that.
So we have a number of specialized programs that we're talking about, and the transition of care really works very closely. And in particular, we have a senior aide a lot of times that supports the efforts in this. So would it make sense a little bit, Stephanie, to talk a little bit about the senior aide and how the senior aide works with the care transition team?
Yeah, what is the senior aide's role, and do they actually manage several people at a time? How is that structured?
So a senior aide is a specially trained aide who has gotten training in chronic illnesses and recognizing signs and symptoms. And the senior aide will speak to the home care worker and educate them on how to observe, record, and report these signs and symptoms. So helping the member to understand them, helping the aide to understand them, so that, again, they're managing the symptoms and getting to a doctor or to an urgent care center when the symptoms are first noticed. And the senior aide has multiple members over multiple, throughout our entire
And so
catchment
a
area.
lot of times we have issues where seniors are being admitted to hospitals unnecessarily, and we're finding that an urgent care center is often even better than an emergency room. Can you please
Sure.
speak to that?
Sure. So an urgent care center is available, for example, when your primary care doctor is not able to see you. Oftentimes they're open on weekends, or they're open late in the evening. So when your normal doctor is closed, they would be somebody that you can go to with an urgent medical issue. And it's much better because you get seen very quickly. You get seen oftentimes within 15 minutes, half an hour, sometimes even quicker than that, versus sitting in the emergency room on a cold, hard gurney for 6 hours.
That happens a lot. That happened to my own mother-in-law several times, and my father-in-law. They were sent to we had the ambulance come, and they went to the emergency room, and they're out in the hallway on a gurney. As you said, cold. I had to make sure they got a blanket because there's so many people there. It's hard for the ER people to give them the attention they need.
Right.
So would you please, Stephanie, speak to the viewers about the advanced care directives and the healthcare proxy? We need to take a few minutes about both of these because not everyone is getting this paperwork together.
So a healthcare proxy is a form that's signed by the member to indicate who would be able to make medical decisions for them if they're not able to make those decisions for themselves. And that would include any kind of treatments or medications or whatever the doctors might want to provide to the member, and they would have that discussion with the healthcare proxy if the member's not able to speak for themselves.
Well, how do they get a healthcare proxy? Where do they get a form like this?
So every hospital social worker can fill out a form with a member, and our care managers also fill out the forms with our members.
But what happens if somebody's mom or dad or other loved one is admitted to the hospital and unconscious, and they haven't got a healthcare proxy? Who makes these decisions?
There's actually a hierarchy that the hospital goes by to say, so the first person would be the spouse, the next one would be a son or a daughter, the next one would be a parent, then it would be a sibling, and then it's kind of the catch-all of other.
So it's good to have these decisions already set forth in writing as to who's going to make these
Absolutely.
decisions for you,
Absolutely,
rather.
because if you don't want your spouse to make medical decisions for you, for example, you would rather have your children do that, you should assign your children to be your healthcare proxy rather than, because otherwise if you don't designate them, then your spouse would have to be the one making the decisions.
So you said this form is available from a social worker to hospital, but where can people get these forms who are not yet admitted to a hospital? They just
The
feel it's
Department
time.
of Health, their website, Department of Health website has them.
And they're free.
And they're free, and they're available in multiple different languages. They're available in English, in Russian, Chinese, Spanish.
This is very important for anybody, especially over the age of even 50, go to the Department of Health website and get a healthcare proxy filled out and signed. I just had one done recently, actually, between my husband and I feel good about it because in case he's even not around or something happens, it's good to know that it's already in writing that who my second choice is if something were to happen to both of us. Let's say we had an accident and Peter couldn't speak and I couldn't speak. I have an alternate listed
Right.
as to who's going to make these decisions, and that person knows what I want done and not done to
Yes.
my body if something happens to me. So this is an important topic.
Yes. And just one thing that happens quite frequently is that the person who you assign as your healthcare proxy cannot sign as the witness. So you have to get 2 independent witnesses to sign the healthcare proxy form.
Very important, thank you. And what was the other form called?
Advanced directives.
And tell the viewers what that is real specifically, because I experienced this in the nursing home with my mother-in-law recently, and I'd like you to share what kind of directives that involves. So
Sure.
people can really understand how important that form is.
Sure. So an advance directive is a form that you fill out that indicates your wishes for certain medical treatments depending on what your medical condition is.
Well, then how is that different than the other form? It sounds so similar.
The healthcare proxy is just naming somebody to make decisions for you. The advance directives helps your healthcare proxy to make those decisions by giving them guidance as to what your wishes exactly are.
And what could some of those wishes be?
So, for example, if you wouldn't want to be resuscitated, or if you wouldn't want a feeding tube, or if you wouldn't want to be back in the hospital if you have another medical problem.
Well, I experienced something at the nursing home with my mother-in-law and with some other residents there. I saw that when it was lunchtime, that an aide would do this to the person. Their mouth would open and they'd get fed. I didn't think anything of it. I just was noticing it. But I learned later on from a guest that came on the TV show that this is actually, in a way, forced feeding. Because but for the person doing this, and a physiological thing happens that your mouth opens and food goes in, no food would be going into the resident. And while we think we're doing something humane, it may be that they preferred not to be fed that way, but just to die a natural death of less eating and eventually, you pass.
Right.
I mean, this was really an eye-opening experience for me. It's a weird topic to talk about, but I don't want anyone tapping my mouth. I open it, they stick food in it. If I'm at a point where I'm not eating anymore, quite frankly, I want to go to heaven. I don't want to be on this earth. if I'm not conscious enough, and I won't be conscious enough to know how to chew my food and digest it.
Yeah.
That's just my personal opinion. Somebody else would like to say, keep feeding me and do what you can. Just keep me on the earth, and God bless them if that's their choice.
Right. And that's important to put in your advance directive so that the person who's making these decisions for you has some guidance about what your wishes are.
And too often, people will say, when we talk about long-term care insurance policies, they'll say, oh, if I'm ever in that poor condition, just shoot me. I mean, the reality is no one's shooting anybody, and you have to make these decisions, and it's good to make them while you're coherent and you don't have dementia, and you're able to make these decisions.
Advanced directives is a big focus of ICS and our care managers, making sure we're working through the member, working through the family member, so that we can get these advanced directives in place for as many members as we can. We're trying to get to 100%. I don't think we're there yet.
No.
Do you know anything in terms of
No, I don't know.
where we're at percentage-wise?
No, but there are some members, unfortunately, who are not able to make, unable to
It's
assign a
past
healthcare
that point,
proxy.
yeah.
So
Right.
we're not going to ever get to 100%.
Right.
But that you're aiming for 100 is terrific.
Right.
And another reason why I just fell in love with Independence Care System, there's so many things I learned about your organization and the fact that you take this so seriously, that it's one of your objectives in your, I suppose, your business plan or your care plan
Yep.
for residents. I appreciate that. Thank you. What about before leaving the hospital? Once a loved one is in the hospital and before they're leaving, what should they do?
So one of the things that you really need to advocate for yourself, and you can also have your care manager advocate for you, is making sure that you understand your medical condition, making sure that you understand why you ended up in the hospital, making sure that you understand what medications they changed, what tests they had done, and what those tests showed. So making sure that you really understand all of that. And if you don't understand it, keep asking until you do. Or ask somebody in your family, tell the doctor, I really don't get it. Can I get my daughter to come and hear this information as well? Because I'm not really understanding this, and I think my daughter would understand it better.
Beautiful, beautiful. That's so important.
Yeah.
In fact, people who are about my age and they have a family member, a parent probably, that is in the hospital, and I feel that if your parent cannot tell you about the tests that were taken and what the results were, you need to jump in and call the doctor and get the information yourself,
Right.
right? Because they wouldn't be able to necessarily communicate or articulate well enough
Right.
what has been
Right.
done and what
And-
going forward, what the prognosis is and what kind of care they need.
Right. And 4 years are always better than 2.
Yes,
Because usually when you go to a doctor, most of the information just goes in one ear and out the other. And so if 2 people are there listening to it, then maybe you understand 50% of what was actually said in the conversation.
very helpful. Can you
So-
get transcripts from the medical provider?
No, but you can get medical records.
But
that-
sometimes, a friend of mine recently who has a heart condition showed me that some medical records, and none of us could understand what they were saying. I don't know if they were I don't think they were in Latin, but they were in some kind of,
they use a lot of Latin terms.
oh, they do then. I
Yes,
wasn't
they do
imagining
use
it.
it,
I
yeah.
said, I don't know what I'm looking at. None of us could understand what every
Yes.
other couple of words we just really couldn't understand. So I think there should be then some kind of move to stop having these records written and submitted in Latin, unless Latin becomes a common language in our country. What's going on with this?
Well, again, it's important to make sure that you understand everything before you leave the hospital or before you leave your doctor's office, so that you don't have to depend on getting the medical records and trying to sift through them.
Who can translate the Latin?
Right.
This is astounding. I can't even, so I wasn't imagining it. It just happened a week or 2 ago, and it's been on my mind, kind of way in the back of my mind, and I'm thinking, and now you're just confirming it. It was in Latin.
Yes.
So who's writing the Latin? The doctors are writing
doctors.
Latin. And between the sloppy writing and the Latin, lots of luck trying to figure out what your medical records say. That is a very serious thing to me, that we have to, in this day and age, with all the HIPAA and all the other regulations we have in favor of patients' rights, this should be the right that our records are in English in America. Do you not agree?
I agree.
Right. And in small enough terms that people can actually understand what that means.
Plain English, like they do with legal documents nowadays. I'll call it plain English as opposed to legalese, right? So instead of medicalese, it's got to be an Englishese.
Yeah, I mean, if you're dealing with a senior who has maybe some cognitive issues right from the start,
Right.
and then you're dealing with something like this, it just compounds the
Compounds
issue.
it.
Yeah.
This is terrible. Viewers, I hope you're hearing what we're saying here. This is astounding that in this day and age we're reading Latin for our medical records. I'm just aghast. So thank you for informing me about that.
Pretty interesting. We talked about what's happening and the questions that we should ask in
Yes.
terms of making sure we know what to do when we're going from the home or the
Yes.
hospital back to the home. But maybe, Stephanie, you can talk a little bit about the work that the care transition team does with maybe complex situations when someone's in the home, kind of following them, making sure they're taking the proper protocols to prevent them from being rehospitalized.
Yes.
Thank you.
So we have transitions nurses that go out into the home to see members who have had potentially avoidable hospitalizations, such as congestive heart failure, COPD, chronic obstructive pulmonary disease, asthma, pneumonia, things like that that are commonly avoidable,
How are they commonly avoidable?
because those have warning signs that you can see before you end up in the hospital. So these have warning signs that where you have the yellow zone, where you could have gone to your doctor or to an urgent care center before ending up in the hospital because you're in the red zone.
Oh, interesting. Thank you.
Yeah, there was one situation I recently read about where a person, I think 6 times, was in and out of the hospital.
They
Can you
were
talk a little bit
constantly
about-
in and out of the
Yeah.
hospital, and our nurse just took the time to educate them about the signs and symptoms to look out for, educated them about making sure that they're weighing themselves every day, that they're checking their blood pressure occasionally, and all of a sudden they stopped going into the hospital
Oh, that's great.
because they now were able to advocate for themselves and say, I'm noticing these symptoms, let me call my doctor, and they didn't end up in the hospital.
so much better than being in a
Absolutely.
hospital where we can incur other diseases, access and reinfections and all.
Right.
What about the caregivers who actually encourage loved ones to go into the hospital so that they can get a break? Do you run into that a lot?
Well, we do have respite services, which means that we would pay for a member to be in a nursing facility for up to a month so that a caregiver can take a break.
How does that get initiated?
If the caregiver is feeling overwhelmed, they should reach out to their ICS care manager and let them know that they're feeling overwhelmed or that they want to go on vacation for a couple of weeks and they need someone to help care for their loved one.
An independence care system will pay for the resident or the loved one to go into a nursing home for up to a month. Did I hear that correctly?
Yes. Yes.
I just can't get over this. I'm sure that there's more involved. You can't just say, I want to go away for a month, or can you? Because you want to make sure that they get full-time care.
It takes a lot of planning, advanced planning, so as much advance notice as we can get, because there is paperwork and everything that needs to be completed. And
You've got to be sure that the member is not well enough to take care of themselves full-time, of course, that they
Right.
need 24-hour care or 24-hour attention. And is there a difference?
Right. So, for example, if somebody depends on their daughter to give them their insulin 2 or 3 times a day,
As an example.
or if they depend on their family member to give them food through a feeding tube, they can go to a nursing home to get those services there so that the family can take that break.
They can go there a few times a day, or they can
No,
live...
they'll stay there in the nursing facility.
Why wouldn't you want to have aides go to the...
Because
Resident.
aides can't do those things. Aides
I
cannot
forgot,
provide
yes.
feedings, and aides cannot inject insulin.
Were there any thoughts that we needed to share with the viewers that we haven't shared with them yet?
Well, I think the most important thing with the care transition program, including what we had talked about in prior shows with our specialized programs and services, we work very closely together internally. For example, we have the wound care program. The care transition team might work very closely with a wound care nurse if we're seeing someone who's in the hospital coming back out of the hospital. So there's a lot of coordination. There's also a lot of coordination with the care managers if there's a senior aide that's involved. So we're working internally to try to use the various resources to keep people out of the hospital and as independent as possible.
I love it. That's why they're called Independence Care System. Any other thoughts?
Not at this time, no.
Okay, well, thank you so much for coming on the show, and we hope that you'll come on again. I know that we have a few more shows scheduled, and viewers, we hope you've enjoyed the show. We're on every Tuesday night in Staten Island at 8 p.m. on Spectrum and FiOS, and we're also on in Brooklyn at 8:30 p.m. on Tuesdays on Spectrum and FiOS. So we hope to see you then, and thanks for watching. Bye-bye.